Dear students, welcome back to MVM online lecture series. Greetings from MVM College of Physiotherapy, Bangalore, India. Today we'll be seeing about ankle joint anatomy part 2. The previous lecture we have seen about complete components of the ankle joint bony structures, the ligaments around the ankle joint. Today we'll be seeing about the muscles and also the arteries, veins, nerves around the ankle joint. Now let's see what is an ankle joint capsule. So here you can see the joint capsule and it surrounds the entire ankle on all the sides. So what is a joint capsule? Here we can see the joint capsule. What is a joint capsule? Joint capsule, it is a fibrous membrane. Okay, a fibrous membrane called the joint capsule. It is lined with a smooth layer called the synovium. It enhances the joint architecture. So the synovium produces the synovial fluid, and it helps the movements. The joint capsule contains the synovial fluid produced by the synovium. The synovial fluid allows for the smooth movement of the joint surfaces. So look at the joint capsule. Now we see about the tendons of the tendon and the muscles of the ankle joint. So here we can see the Achilles tendon. So when a person trying to do the plantar flexion, and you can see the action of the backside muscles and also the function of the Achilles tendon. The Achilles tendon is a tough band of fibrous tissue that connects the calf muscle to the heel bone. That's the calcaneum. So it is a tough band of fibrous tissue that connects the calf muscle. That's the calf muscle and the backside you can see. And it connects to the calcaneus. The Achilles tendon is also called as calcaneal tendon. So it is otherwise called as a calcaneal tendon. So here you can see the muscles, the calf muscles, gastrocnemius muscle and the soleus muscle. Gastrocnemius and the soleus muscle. The gastrocnemius and soleus muscle united into one band of tissue which becomes the Achilles tendon at the lower end of the calf. So the gastrocnemius, soleus together forms the lower part. It forms a one band of tissue. So that is called as the Achilles tendon. So next we move to the posterior tibialis muscle. So here in the posterior side, you can see the posterior tibialis muscle. The tibialis posterior, otherwise posterior tibialis, is the most central of all leg muscle. It is in the center part of the leg in the posterior side. It's located in the deep posterior compartment of the leg. It is the key stabilizing muscle of the lower leg. Blood is supplied to the muscle by posterior tibial artery, and it is innervated by the tibial nerve. The tibial nerve supplies to the tibialis posterior muscle. So what is the action of this muscle? So the action is inversion of the foot and the plantar flexion. Inversion is towards the medial side, movement towards the medial side, and the another action of this muscle is the plantar flexion. So moving the foot downward. Okay, downward. That's called as the plantar flexion. Already we have seen in the previous lecture. So next, here we can see the muscle action. So the tibialis posterior muscle action you can see over here. This is about the tibialis posterior. So next we see about the tibialis anterior. So the muscle which is there in the anterior side. So here you can see the anterior. This is the posterior side, and move to the anterior side. Here you can see the tibialis anterior muscle. The tibialis anterior muscle in humans that originate in the upper two-thirds of the lateral surface of the tibia, upper part of the tibia, and inserted into the medial cuneiform and the first metatarsal bones of the foot. It acts to dorsiflex and invert the foot. Look at the movement. So here we can see the action of the muscle. So this is the muscle anterior tibialis. So what is the action? You can see the action is moving the foot upward, pulling it upward. So that's about the tibialis anterior muscle. So next we see about the peroneal muscles. So here we can see the two peroneus muscle. Actually, there is a three peroneus group of muscles. One is the peroneus longus, peroneus brevis, and peroneus tertius. So the peroneus muscle is also called as the fibularis muscle or peroneals or peroneus, or a group of muscle in the legs. So while the muscle group exists in many variation, it is normally composed of three muscles. Okay, the peroneus longus, peroneus brevis, peroneus tertius. So what is the action of this peroneus muscle? Its action or eversion and plantar flexion. So what is the action? So here you can see the muscle, peroneus longus and the peroneus brevis tendon also you can see. So what is the action? So action or eversion and plantar flexion, but the peroneus tertius action is eversion and dorsiflexion. Next we too see what is the nerves over here. So on the back side you can see the posterior tibial nerve. Look at the posterior tibial nerve. It supplies to the muscles around the posterior part and also ankle and the foot. And then now we move to the anterior side. You can see the deep peroneal nerves. So here in the nerves on the back side you can see the posterior tibial nerve, and the anterior side you can see the deep peroneal nerves. And also in the anterior side you can see the superficial peroneal nerve. So here you can see the anterior part, what are the sets of nerves. So the two nerves, the deep peroneal nerves, superficial peroneal nerve, deep and superficial peroneal nerves together you can see. What is the nerves in the back side? The back side we have seen it is a posterior tibial nerve. So posterior tibial nerve, the anterior part, deep peroneal nerve, superficial peroneal nerve. So here we can see the blood vessels, the arteries over here you can see. Dorsalis pedis artery, that's the anterior side, you can see the dorsalis pedis artery. And turn to the posterior side, you can see the posterior tibial artery. So the two main arteries, here you can see the dorsalis pedis artery in the anterior side, and the posterior side we can see the posterior tibial artery. So this is what about the ankle joint. And in ankle joint we have seen about the components of the ankle joint. That's the tibia, fibula, talus forms the ankle joint we have seen. And also in the previous lecture we have seen about what are the tendons on the lateral side, the connecting tendons from the talus to the fibula and the lateral side, and the medial side we have seen the tendons of the deltoid tendons on the medial side to stabilize. And also we have seen in the anterior and the syntesmosis ligaments we have seen. So that's the ligaments, muscles, nerves, blood vessels, and the ankle joint. Ankle joint is a very important joint during an ambulation because it adapts to the surface on which we walk. Ankle fractures are very common in all ages with the involvement of one or both malleolus. So the both side, fibular and the medial or lateral malleolus could be involved. The fracture pattern determines the stability of the fracture. Ankle sprain is the most common musculoskeletal injuries. The females were at a higher risk of sustaining ankle sprain compared with the men, and children compared with the adolescents and adults, with indoor and court sports the highest risk activity. So here you can see the references for the entire ankle part 1, part 2, ankle part 1, part 2. So with this we conclude the ankle part 2 lecture series. If you have any doubt, any clarification, you can contact me directly. Thank you very much.